Hi, we are live. I'm Dr. Dara. This is Truth with Dr. Dara. I have a couple friends hanging out with me at the moment. Are you guys safe? They're excited to be here. So tonight we're going to talk about post-traumatic stress disorder. It's been some week for me. I don't know about for you guys. I see some of you are just jumping on, so when you get on, you're welcome to put any questions down below, or you can post any comments. You're always welcome to email or DM me at any time, but please put your comments. I see some of you are getting on, so thank you for taking your time to be on with me tonight. You know, I usually feel like I get on kind of chipper and excited, and just the thought about talking about post-traumatic stress disorder has me in a different frame of mind. I know this week I did many interviews, and there's been a lot of talk about the suicides that occurred from the Parkland students, the students that were in the shooting last year, a little over a year ago. And I've been asked many questions around it. And the thing is that post-traumatic stress disorder is something that is very serious and very complicated, and it affects more of us than we realize. I know that with people say to me, oh, well, how do you detect signs? And the thing is that there's so many signs, and it can be so different for everybody. So before I completely dive into this, I'm Dr. Dara. This is Truth with Dr. Dara. You guys are on Facebook Live, and you're also on Instagram Live. Please put any comments or thoughts that you're having in the comment area below, and I'll get them as soon as I can. And tonight we're going to talk about post-traumatic stress disorder. People often say to me, well, what is it? And really the way that your mind is reading information, because yeah, I am heavy on my mind, and a lot of us, is what happened for the Parkland students that that took their life with suicide or by suicide, and because of the anguish and the pain and their experience at the Parkland shooting that was over a year ago. I grew up in Coral Springs. I went to high school there, and every time I'm connected and I talk around and about different ideas in regards to it, it really brings up thoughts and memories and information in my mind. And that's the idea that happens when somebody experiences post-traumatic stress, is that there's information that's stuck. They're reading old information as being current. But for some of us, when we think of old information, it just comes in and it goes out, and it doesn't have an emotional attachment or reaction to it. But for other people, there's a stuckness. It's like on instant replay. It's like with when you remember the record players, I do, and when it's on the vinyl record player and it just keeps skipping over and over and over again, or when you have a cassette player. For some of you, I'm completely dating myself, but when you have a cassette player and it just keeps playing repetitively over and over, like it's skipping, that's what's going on in the mind of somebody that's experiencing post-traumatic stress disorder. What is the trauma? You know, what is going on for the person? Well, they're experiencing anger or fear. Usually it's typically around fear, and the fear is a physiological or an emotional response to the perceived threat. Because if we go way back in times with studies, we look at twin studies, or we look at combat studies in regards to people in the military, and there can be two people in the same place at the same time, and they both have a completely different experience. And that's still not understandable to us, but it is becoming more and more to make sense, and having some different conceptualizations through research. Of recent, there has been a lot around this idea of trauma-informed, and it talks about nature and nurture. A lot of times people ask me, well, when somebody is experiencing trauma, is it nature or is it nurture? But the essence of it, what it is both, because it's how you're wired, and then it's also about the experiences that you have in your life. One of the questions I got asked many times in the interviews that I had is, how does it happen for one person and not another? And it has to do with nature and nurture. And with the trauma-informed studies, it's showing that these traumas are impacting us due to the way that we're wired, and they're showing that the wiring is happening in utero up until we can be 4 years old. So there's already these imprints, like this blueprint that's in our mind, this predisposition for some of us. And then you take different scenarios, and there's a study, it's called the ACE study, and it's a questionnaire, and it asks you about different events that you've experienced, like when you're a child, if you've experienced sexual trauma or emotional trauma or abuse. And it goes through and asks about, I think it's about 8 or 9 questions. And with that, it would automatically maybe give you a rating if you're predisposed to experience different kinds of trauma. So you take that mix together, and then you have 2 people or multiple people that experience a traumatic event, and everybody is going to have a different response. Everybody is going to experience it differently. So that is the foundation that's often set around PTSD, post-traumatic stress disorder. And it's in the nature. So there's not a one size fits all with it. And just as there's not a one size fits all the way it's happened for somebody, there's not a one size fits all the way that they heal. Now, I work with a modality called rapid resolution therapy, and I do see people healing from PTSD. I see people healing from multiple traumas in a short period of time, because somebody who's experiencing PTSD does not want to experience it repetitively or ever again. It's horrifying. And the things that you do see in people who experience PTSD, I know that there's more of the common signs of maybe somebody who's withdrawing or having nightmares, increased anxiety, they're not sleeping, they're not doing things that they enjoy, depression, they're feeling very sad, isolating, stopping doing things that they like. Often you'll see people drinking or using drugs more often to numb the pain. Maybe you guys can chime in if there's some different symptoms that you guys are aware of or have experienced that has affected you with your post-traumatic stress disorder. And with the PTSD, you'll hear people talk about little t's and big T's. And there's different ways of explaining it, whether it's a certain type of trauma that you've experienced that makes it into a little t or a big T. But at the end of the day, again, it's the way that your mind is having a perception around an event that happened that can relate it to being traumatic or non-traumatic. And with the stigma that's in our society these days, it can be really complicated, because people think that if they tell people what's going on for them, they often can be seen as weak or vulnerable, or that there's something wrong with them. And there are a lot of stigmas in mental health. I got asked the other day, why don't people report, or do we need more help that's out there for post-traumatic stress disorder? And the component of a lot of that is there is treatment, but oftentimes the treatment is continuing to re-traumatize the situation that somebody already had by re-stimulating it, asking them questions that are going on and not going on, and really poking at it. And there's some modalities that do that. There's treatments like, and it's not a one size fits all. Again, the same way that somebody experienced PTSD, it doesn't mean that there's one treatment for everybody either. And as guys that know me, I do use rapid resolution therapy, and I see it as being effective because I don't see people reliving the trauma or having to go on a fishing expedition and pull things out the way that they were before. It's kind of meeting with somebody right where they're at with the symptoms and what they're experiencing right now, and giving them a way of thinking, like thinking about trauma in a way that is, I mentioned this before, but that it's the mind getting stuck, reading old information as being current. It's not about who the person is or that they've done something wrong. There is that part that's the way that we're wired, and it is about past experiences that we have that play into effect how somebody internalizes it or continues to have an effect on an event or situation. Why do 3 people experience nightmares and 2 people don't? Why does somebody have increased anxiety and it just fades out, where another person, it starts consuming them every day? And that we'll never understand, because there can be, you guys have brothers and sisters, right? And how you grew up in the same household, the experience can be so completely different. And that's what is happening for people that are experiencing traumatic events. And so treatment modalities or therapies are just continuing to talk about it, and every single week talk about it, talk about it, and talk about it. And if you're talking about it every single week, then how does it start to fade? It just starts to tie in, and your mind wires everything of what's going on. So if you do have a memory and that's what it's thinking about, then every time you revisit it, it's going to appear. People will say to me things like, well, is there a timeline? Is there a way to cope with it? And everybody is going to cope differently. Some people are going to show symptoms right away, and some people are going to show symptoms down the road. I think about how there was so many people in the shooting, and I had the honor of getting to treat people from the Parkland shooting or with trauma. I've had people call me all over the country that it's been re-stimulated for them if they've experienced traumas in the past just from another event, and it has affected people in so many different ways. I work with athletes, and I've had athletes ask me in other cities or towns want to do a session because of how the shooting impacted them because they were friends with people on other sports teams. And so it's not just localized. It doesn't just happen in our community. It happens to a lot of people. And why does it trigger people? Well, there's no exact science why it does. I explained that there's a couple components that go into it, whether it's nature and nurture, and what your exposure has been to past traumatic events, and the way that you're wired. But also it has to do with the way that you see it, like the perspective of it. And if somebody is thinking, because I hear a lot about survivor's guilt this week, and why do some people experience it and why do some people not? And again, it's what is going on for the individual person. And so the way to treat this is by separating it from it being who we are, that it's an experience, and it's the way that your mind has read some information, and that it's a data misread. And so by associating it and changing up some of the wiring, somebody can no longer feel that sense of emotional connection to it, and therefore the nightmares stop, the anxiety, the drinking, the drugging. There's so many symptoms that play along with it. So I would gather you're saying there's no exact way, and there is so many different types of traumas that one can experience. Does one type of traumatic event affect the magnitude or the degree of the trauma that somebody experiences? No, because again, it gets internalized by every single person so completely different. So I'm just gonna pause for a moment. I see a lot of you are jumping on, and we're talking about post-traumatic stress disorder. And if you have any questions or comments, please put them down in the comments. I'm on Facebook and I'm on Instagram, and I really welcome those of you who did join, because nobody is untouched by this, whether you haven't experienced feelings or been affected by the Parkland shooting. None of us go untouched by the time we're 30 years old. We've all gone through different experiences that can be perceived as trauma. Little t's and big t's has to do with the way that your mind is seeing it and how it's impacted you. Some research will say that it has to do with how many times you've experienced it, if it's been over a period of time of smaller type traumas, or if it's been something that's been sudden, like a big trauma of a rape. But trauma is trauma, and again, it's the way that each person individually experiences it, and also the perceptions that they get around it, because the stigma is what is so tight. Why don't people want to go to therapy? Well, there's a very mixed message. Why would you want to go to therapy if it's this feeling that it's something you have to do for the rest of your life, and it gives you this message of being broken? And that's what I love about what I get to do in rapid resolution therapy, because it is letting somebody know that this is fixable, and it can be done in my average of experiences between like 1 and 3 sessions. So 1 and 3 sessions, and they're not experiencing the trauma any longer. It's not that they forget. It's not someone doesn't remember what happened to them, but it gets told as it's a story, and it's not something that has the emotional connection that creates that intensity in their everyday lives. It's John Kabat-Zinn who talks about that by the time we're 30 years old, we've all gone through different experiences. And I think of it like if you were carrying along a big sack, like Santa Claus, in your bag, that all these things just go along with you, and they're just part of your life, but it doesn't mean that that's who you are. And that's what gets weaved in with these things that have gone on for us, whether your experience has been being bullied, or it's being that you were sexually abused, or you were physically abused, emotionally abused. It doesn't only impact you if you were a child or if you were an adult. It affects everybody, and it doesn't discriminate. Trauma does not discriminate, and it is also not who you are, and it is not your identity. It is just something that has happened as an event. It's something that went on, that you experienced it, but it doesn't mean that it's something that always has to torment you, because in some of these modalities and these treatments, I mean, seriously, I've had clients come to me and say, I wanted to do this treatment, and they said to make sure that I didn't have anything going on that was important for a significant period in my life, because it could cause me to feel emotional or dig up some stuff in my life. To me, that is ludicrous. That is insane. That just makes me cringe inside. You've already experienced a traumatic event. You don't have to continue to relive it over and over and over again. And I remember when I was in graduate school, which I paid a lot of money for, they would say things like, if you are sitting with somebody who's been raped, don't go anywhere near them. Well, I'm thinking that the event that already happened is what is traumatic, and me sitting as far away from them as possible is not going to make them feel any better. In fact, it almost feels that that's what's perpetuating the shame, not giving them a place to feel comfortable and safe. So that's a very mixed message for me. And I also remember being taught to sit really far and close to the door so that in case somebody were to get violent with me, I can get out of the room. Again, how do you create a sense of connection if you're way far from somebody and you're not sitting in a proximity with them? I mean, that would be like going to the doctor and then checking your heart rate or taking a physical exam with you across the room. That is just absurd. And that's some of the messages that are getting relayed around trauma and post-traumatic stress disorder for people. Well, why would they want to report it? They feel awful. And that's another thing with post-traumatic stress disorder. It's only what's being reported. People are not even telling us. The numbers are, they're just, I mean, we can see how much trauma is reported. In the military, there's 29 people a day that report suiciding due to post-traumatic stress disorder. I mean, why would they report it when they're going to be belittled or badgered or made fun of? So people are dying, and that's only what we know as far as like suicides. And that's something else that comes to mind for me around, the Parkland shooting is people say, well, what, it is scary because it's a year later and now these are the repercussions that happen. Well, let's think about our combat veterans that go off to war. They don't just come home and then have these problems. It can occur for them years later. I mean, I think of recently the Me Too movement, and I was asked to speak on a panel, and it was when the whole situation with Kavanaugh, and a very intelligent woman comes forward and she discusses her sexual abuse and her sexual abuse or mistreatment, and it was like, well, why are you reporting it now? Well, something happened for her and it felt that it was needed to be done now. It doesn't just automatically happen that then you go and report it or you have an experience after a traumatic event. It can happen at any point, at any time. And I know that's very scary, but that's what all the studies are looking at with our veterans, that it's not happening right in that moment. They go home and they try to implement and get acclimated into their lives, and it's only months later or after another event happens that they have these symptoms that flare up. I'm just gonna check in. I see some comments. Penny says, so good, so important, you're amazing. Well, Penny, I think you're amazing. I see Helene, that you're on here. I see Paula, you're on here. Some of you are seeing my hand on Instagram. I'm gonna try to scroll through the names. I see a bunch of you down here on Instagram. So please, if you have questions, comments, put them down, because this is serious business. I talk about a lot of different topics when I get you guys on here, and at the end of it, behind all of it, is the way that our mind processes information. It's the way that it reads data, the way that it takes it in is gonna be what impacts us and affects us and shows up for us later in our life. I know people don't openly go, oh, you know, hey, I was raped when I was 3, or I was raped when I was 17, or I was sexually abused, because it's frowned upon and people feel a stigma and they feel judged about it. But it's not what's happening to them. It's not who they are. It's something that just happened to their body, right? It happened to their body and not who they are. If someone said to you, I just experienced a trauma, you wouldn't say, well, hello trauma, how are you? You would say hello to their name, and you would notice who they are as a person and what's going on with the kids and the students and the adults and the teachers and the community that just went through such a horrific experience at Parkland, is that it continues. Their lives go on, and I'll repeat it again, for so many, their minds is reading the old information as being current. It doesn't seem like it was a year and 2 months ago for them, or a year, and well, really it happened on February 13th, I believe, because or 14th, because I remember the next day speaking and helping and trying to be a voice of healing for so many. Like, how do you talk to your kids, and what do you tell them to go back to school, and how do you eliminate that fear? But the way to address post-traumatic stress disorder and trauma and these tragedies is to talk about it and to be open and sincere and treat other people how you would want to be treated, and ask questions that even feel scary. A lot of people don't ask because they don't want to know the answers. They're scared of the answers. They're scared if they ask their child if they're having thoughts of hurting themselves, that they might say yes. But I have news for you. Not asking is not going to make it any better. Oftentimes when people are feeling so raw and so hurt, they just want to be heard. They want to feel a sense of connection, because what they're feeling is that nobody else can relate. Nobody else gets what they went through. And when we're talking about survivor's guilt, people are thinking that it's a matter of deserving, that it should have been them whose lives were taken, or thinking that it should have happened to them, and it shouldn't have happened to other people. And they're living the trauma, they're living the thinking that it's continuously happening in their head. And so I beg of you guys, it's not even that I invite you, I beg of you to talk about this, to communicate. And if you know somebody that is struggling with trauma, get them to a rapid resolution therapist. I'm one. There's many more of me out there, and they're going to be able to effectively and clear trauma painlessly, so that it doesn't have to be this treacherous, re-stimulating thing that happens for people over and over and over. Going through a traumatic event once is enough, not having to relive it and continue to talk about it like it's something that you've done wrong. So once again, please send me questions, send me comments. If you aren't doing it right now, today, this is something that we can continue to talk about it, as it impacts so many people in our community, in the Parkland shooting, and to everybody that have experienced different traumatic events. You know, this month is Women's Month, and tonight, originally my intention was to talk about guilt, but this felt like this is what needed to be talked about with more importance and with more intensity. And so that's where we're at. And thank you for those of you who commented in the group requesting this and asking to talk about this. I appreciate your feedback. We're going into April. To me, April is I keep thinking about April showers brings May flowers, and thinking how important it is to start really clearing out our minds, clearing out our closets. And we're into the second quarter, and it's a great time to really reflect where it is that you want to move ahead in your year. There's holidays this month, there's spring break, there's a lot going on, and the days go fast, and you never know when things are gonna come up. I think of Garth Brooks' song when he sings, you know, I don't think that was Garth Brooks. Garth Brooks was Thank God for Unanswered Prayers. I do think about that sometimes, how we ask for things and we kind of get what we need, sometimes not always what we want or what we think we need. but just about living each day as if, I think it was Tim McGraw, you guys can help me out with that one, but living each day as if it was your last day, and what would that be like for you, and what would be the imprint that you would want to leave. And as we close up and we're talking about post-traumatic stress disorder, that's what we're talking about. We're talking about an imprint that's been left in somebody's mind and it is getting stuck for them. And so we can unstick that. So be sure, if you haven't already, to join my Facebook group, Truth with Dr. Dara, and there'll be a new newsletter going out soon. So if you haven't registered already, send me your email address, or you can go to my website, drdara.com, and you can register there. I thank you guys for tuning in, and it is always such a pleasure. I woke up this morning not with the same sense of like excitement of talking about this, but with a sense of urgency to talk about this, because I know that it's affecting so many people. So I'm just gonna check in here. I see these questions or some comments. Thank you guys, and have a good night and take care. And I will see you next week, same time, same place, 8:30 p.m. Eastern Standard Time. Truth with Dr. Dara. And if you have any specific topics or questions that you would like to see us talking about, please send them in. All right, take care, everybody. Bye-bye.